Dear colleagues, thank you for the opportunity to present our quality improvement project on patients' preference to sacral neuromodulation. I have nothing to disclose. Sacral neuromodulation is a guideline-recommended treatment for patients with refractory overactive bladder following failure of conservative therapies. SNM is also an effective treatment in non-obstructive urinary retention. Prior to 2019, only one device, the Medtronic InterStim II, with head-MRI compatibility was available. However, since then, 3 full-body MRI-compatible SNM devices with different characteristics have become available, thus offering more choice for patients and allowing more patients to have this therapy. If we look in detail to these new devices, concerning the InterStim II SureScan, the implantable stimulator is quite similar to the previous InterStim II, delivering a constant voltage stimulation with the same size, 14 cc, but is full-body MRI compatible, and this device is non-rechargeable. More recently, Axonics developed the first rechargeable system called r-SNM, which is also full-body MRI conditional. The Axonics r-SNM system is a miniaturized, rechargeable SNM system designed to deliver therapy in the body for at least 15 years with a constant current stimulation. The last one, the InterStim Micro, is a very small implantable stimulator, full-body MRI compatible and rechargeable. It's tested to deliver therapy for at least 15 years too. Due to the recent introduction of these devices, no study has been carried out to determine which criterion seems to best guide the patient in the choice of treatment. The aim of our quality improvement project was to capture the patient's preferences regarding choice of SNM device in order to develop a patient decision aid. The study was prospective monocentric. All patients undergoing a test phase by percutaneous nerve evaluation lead placement between June 2020 and April 2021 were enrolled in the study. Patients were shown the different devices with detailed discussion about their characteristics. Then they were asked to fill a structured questionnaire before and after the test phase, if responders. Patients were asked to assess the following items: size of the battery, of the remote control, items about the rechargeability, about the number of programs, etc. And they were asked to rate each item between 0 and 5 regarding the importance of the item in patient's choice. Finally, they were asked to determine which device they would prefer to have. 62 adult patients were included in the study. Among the 37 responders, 36 filled the questionnaire before and after the test phase. For each item, regarding the mean scores, no difference was observed between before and after test phase. When comparing each item to each other, item 2, the size of the remote control, had a significant lower score in the overall population, as well as before test phase. In the overall population, as well as before test phase, the highest scores were observed for item 5, the ease of recharging, 7, number of programs, and 8, number of revision surgery needed in the future, which therefore seems to be important criterion in patient's choice. After the test phase, the frequency of recharging was also an important criterion. When we look at the score obtained by item, according to the device choice, a significant higher score was obtained for item 1 and 8 for InterStim Micro when compared to Medtronic InterStim II, which suggests that the size and the longevity of the battery were important criteria to choose between the two different devices. 9 patients changed their mind during the test period, 4 for a non-rechargeable device, 2 changed for a rechargeable device, and 3 changed between 2 rechargeable devices, the final choice being the InterStim Micro. Final choice was InterStim II for more than 60% of patients. Since 2019, new devices are available for sacral neuromodulation with new characteristics, in particular MRI compatibility, rechargeability, a smaller size, and longer life expectancy. The choice of the device is made by considering the surgeon's preferences, and is also made by considering patients' preference related to lifestyle, ability, and willingness to deal with a rechargeable device. In our study, items related to the rechargeability, life expectancy, and the size of the battery were the main criteria to guide patients' choice of device. The final choice was a non-rechargeable device for more than 60% of patients. These results highlight the fact that the recharge burden can be experienced as an important constraint in the daily life of patients, even if the stimulator has a smaller size and a longer life expectancy. In our experience, the PLE test phase gave patients an opportunity to consider their options. Thank you for your attention.